Okay, so I'm just getting into the science part of the Total Gut Restoration with Microbiome Labs. Now, what we know is that this is our foundation protocol. And once you know how the products work, it's about customizing it for each person, not having a customized protocol for each condition. So the first thing to understand is about reconditioning. We don't reseed a microbiome, but we can influence it. And the spores have been in the human gastrointestinal tract since the dawn of man, and it helps train our immune system, and it's very necessary for it to be there. And we've even found that when infants aren't exposed to these spores, they develop immune deficiencies. So this conditioning of with the spores is very important. They're really the ones that decide, who are the friendlies, so who should they manufacture metabolites for and feed, and who are the enemies, and who should they manufacture specific antibiotics and kill. So that's what we mean by reconditioning. The second,
do you use these for children?
yes,
Okay,
absolutely.
how young?
Pardon? How young?
How young?
Well, what we're allowed to say as far as on the FDA, on the bottles, I think is 8, but know that newborns, there are mothers that are putting it on their teats, having newborn suckle, especially if they've been born with gastrointestinal problems. We have a lot of pediatric clinics that are using Megaspore. We thought we would go into a pediatric line, but really they've just been opening up the capsule and titrating it for infants and children. And they, instead of, pediatric products have a lot of flavoring, colorings, and they're putting it in liquids, which is really not necessary. Kids, you can find foods and beverages to put these spores in. They're basically tasteless, and then we're not having to add a lot of flavoring, sweeteners, and other things.
Yeah, so I've got a friend who her son has had, both of her sons have been getting sick so much lately, and one of them is probably less than a year old, but he's had like 5 ear infections this year. Yeah. And I was just wondering, like, and they have to go on like medicine all the time because they're trying to recover, and so like I worry about their gut, and I'm like,
right,
should they be taking? I think they are taking a probiotic, but so right, like, and I would wonder.
And that what we'll learn, about probiotics is, as we get further into the presentation, that we know 98% of all probiotics die in the stomach. So you're really getting a limited metabolic response. There is a response, but you get so much more when you've got colonization in the gut and, a better support program. So the second area is what we call the reinforcement, and we're focused on feeding the keystone strains and helping them to thrive. And then the last is to rebuild the mucin layer to really seal the gut. So once you have, those in place, and I'll show you where they are, when we're talking visually, the mucin 1 layer is the top layer, which is where we have the reconditioning area. And this you see is represented with several different colors of organisms. This is representative of good diversity. And we know with studies, the better diversity you have of organisms, the stronger and more robust your defenses are. What we also see in this is there is some endotoxin represented by this, LPS, lipopolysaccharide, but it's being dealt with. It's absorbed within the mucin 1 layer. The IgA, the secretory IgA, is finding it, neutralizing it, and keeping it from doing any harm. And again, the reinforcement, we know that this mucin, because of diet, because of good oligosaccharide exposure, and that's what these organisms really like to feed on. These fibers in the form of oligosaccharides really help them to thrive. And then this is the mucin 2 layer, which is extremely important because it protects our underlying epithelial cells, our microvilli. The zonulin gatekeepers are able to keep, tight junctions. And then below that, we have the lumen with the circulating immune cells, on patrol for any breach in that barrier. Now over here is the representation of really what is happening with a lot of people in this country. I would say it's an epidemic proportion of gut issues. We've been calling it leaky gut. The scientific term for it is metabolic endotoxemia. And the problem comes with the gram-negative bacteria overgrowing the gut and releasing from their cell wall this lipopolysaccharide, which further reduces the diversity of the organisms and degrades or eats into the mucin 2 layer, which then exposes the underlying epithelials, causes a breach. So the zonulin, opens up the floodgates, and what floods into the lumen is this endotoxin, lipopolysaccharide, but also I'll just continue this. Also undigested food particles and pathogens. Now we focus just on the lipopolysaccharide. These are all of the conditions that can be related to just lipopolysaccharide. And if we, go into this in more detail, you'll see, leptin resistance. So the more LPS, the more inflammation enters the enteric system, and the more, weight issues a person's going to have. Chronic constipation. So as this gram-negative organisms release the LPS, it shuts down the gastric emptying and the bowel motility. It'll affect mood and appetite. You see depression listed here twice because there's two different mechanisms. You've got the inhibition of dopamine as well as, getting in the way of the serotonin synapses, cognitive decline, memory decline, even down, at the bottom here. Get this thing to move. Oops, sorry. First day with my new fingers. That Parkinson's, but we've also know there's association with Alzheimer's as well. So really that gut-brain connection, we see it emphasized here because so many of these things are, considered emotional or, the way our brain functions or nervous system functions. And down here, what's being covered up is autoimmune disease. And I'd say that is really right at that breach where you saw that lipopolysaccharide flooding into the lumen. That piece right there is really the source of so many chronic illnesses, from autoimmune disease to cancers to, let's say, the couple of the autoimmune disease clinical trials that we have undergoing is rheumatoid arthritis and Hashimoto's. But in this next slide, you'll see really how we found out that the spores are so effective against this lipopolysaccharide. And this was published in 2017 in August in the World Journal of Gastrointestinal Pathophysiology. And we went after that metabolic endotoxemia condition because it's at the core of all chronic illnesses. And what we found was, and this was done at UNT in North Texas, and sorry, come back. Okay, so this endotoxin, or the lipopolysaccharide, was reduced by 60%, so highly significant. The other indicators that came into significance within just 30 days was everything on the top part of this chart. So currently we have clinical trials going on with triglycerides, or looking at lipids, because it was significantly reduced. Ghrelin, so we have a weight loss study. The MCP1, and these are indicators that will help us elucidate the mechanisms of that autoimmune disease for rheumatoid arthritis and Hashimoto's. And then in 90 days, more indicators came into significance. So we have a study that's ongoing that has to do with diabetes because of the effect on glucose and insulin. The leptin, that's going to and that weight loss study is tied in there. And then more of these interleukins for inflammation with other diseases. So this was really what put Megaspore on the map, because we were showing clear evidence, not, just that, probiotics help reduce, how a person feels. But it was a very objective study showing actual disease type indicators and resolution. So the way we know how probiotics work is due to this type of study, which is a simulator of human intestinal microbial system, or a SHIME study. And there's a couple of universities and big pharmaceutical companies that do these type of tests. The one that we use is in Belgium at Ghent University. There's another one in Toronto in Canada. But this is the best technology to see, because it's doing an in vitro study of an active digestive system. So what you do is you inoculate this with a microbiome, and then you feed it, and then you're able to see how things work. For instance, you can feed it other probiotics, and that's how we know that 98% of other probiotics just are digested right here in the stomach. And the ones that aren't digested there are going to be broken down by bile salts or pancreatic enzymes. So it's only spores, because they're protected in this endospore, like a shell, are able to get past those gastric barriers and then actually start colonizing in the small intestine. And from there, we can measure how much B vitamins they manufacture, vitamin K, antioxidants, enzymes. So they are very important to the actual function of our small intestinal tract, or our small intestine. And okay, so yeah, that's what they're saying, how we measure all of these. Now, I'll tell you, there's an interesting study that's close to being published, where we took a couple of these SHIME studies in tandem and inoculated with a pristine microbiome, and then interjected or introduced Roundup and glyphosate to see what really happens in the gut. And we found that in just 3 weeks, the glyphosate started showing disease indicators, but even sooner, the Roundup. And so Roundup is much more dangerous because of the surfactants. The body can't get rid of it. And then after 4 weeks, it had all of the disease indicators of colorectal cancer. And then we introduced the spores. After 3 weeks, those disease indicators were arrested. And then after that, it continued to get better. So that study will be published in this coming year. It takes some time to get all of those lined up, but it's good news, because we know that everyone now has tissue levels of glyphosate or Roundup. And so it's not a matter of how do you prevent it, but it's how do you deal with it, because now we all are dealing with it. So this will be good news, that the spores are very effective to helping with that. Okay, so now this is a SHIME study we published not long ago, showing that how much the Megaspore will start jump-starting those keystone strains, but how important the prebiotic is to actually helping them thrive. The Megaspore will help 20%, and then the prebiotic goes in at 80%. So very significant. So it's emphasizing how important to get those oligosaccharides in there, so that these keystone strains, the bifidum, the lactobacillium, the Faecalibacterium perniciae, the Akkermansia mesophila, those are the ones that long-term need to be in charge, because they are crowding out the pathogens, and overall they're what will protect the microbiome long-term. And it's all about setting up an environment that keeps these guys happy. All right, so we've talked about the importance of the Megaspore, how it goes in and reconditions, decides who should stay and who should go, about the food that's offered by the prebiotic, the oligosaccharides for those keystone strains. And then the last step is adding the specific amino acids for the goblet cells to help the body make more mucin, and the concentrated immunoglobulins to neutralize the lipopolysaccharide and help modulate the immune system. And then the citrus polyphenols to shut down the immune cascade that's going on. So that's the final step there in sealing the gut. This is another study that we've published, and it has to do with just one of the spores that's in megaspore. So we have 3 probiotics, the 5 spores, which is megaspore, the 2 spores, which is in Restore Flora, and then the 1 spore, which is in the HU58. But this study is showing just how effective just 1 spore is. This is the Bacillus subtilis. You see HU stands for Holloman University. These spores come from the largest spore bank in the world, which is in London at Holloman University. So that's why their strain names reflect that. And what this study showed was how effective the spores are against this interleukin-6, reducing it by 45%, and TNF-alpha, reducing it by 55%. And also, very importantly, what this spore does is reduce ammonia. And that's why it's the primary product used by Cleveland Clinic and Mercy Hospital in their hepatic encephalopathy ward for helping individuals with liver failure because of its ability to reduce inflammation and ammonia. So each one of the spores in megaspore do something very important. And this is a SHIME study that we published, again, recently, showing how effective megaspore is on the condition IBS-D. You'll see that they compared it to the pharmaceutical rifaximin and showed that it actually scored better than rifaximin. So these studies will continue. Like I said, we have 12 in process right now. Restore Flora is that product that has the HU58 and Bacillus clausii and Saccharomyces boulardii. This product's ideal because, as you'll realize when you start working with these products, they're very strong and all of them should be titrated. So you start with megaspore at 1 capsule every other day for a week, and then the next week 1 a day, and then the third week you can go up to the recommended dose. And you're always giving these at food, with food, and then you add the prebiotic at a half a scoop for the first week, and then the full scoop, and then on the 3rd month you're adding the mega mucosa, half a scoop. But there's sometimes you don't have time to do this type of titration. When you're talking to someone and they're already telling you that they just started taking an antibiotic, for instance. Well, this is ideal because there's only 2 spores, it's very conservative, doesn't need titration, and you can get them some protection right away. And you can take these spores at the same time that you're taking antibiotics because they protect themselves. They'll go back into the spore form when there's danger in the area, and then they'll come back out and colonize when the antibiotic or the assault has resolved or passed through the body. Many times when you're starting to work with a microbiome, even though you're helping it, you know that these products are going to help, everyone's body finds a homeostasis, and they're going to resist any change even when it's good. So you don't always know what you're dealing with because the body's been resisting. It's been finding ways to cope with all sorts of pathogens. So when you're starting to, that's one of the reasons you titrate, because you'll get a pushback. The gram-negative bacteria will start releasing the endotoxin, but then there'll be other things like candida that will start releasing exotoxins. And person may not realize they have an underlying candida. Everyone's exposed to it, most people have it, but if you have a lowered immune system, it's going to entrench deeper. And many of these things will start rearing their ugly heads when you start trying to clean up the microbiome. So we designed this product, which is very effective against candida because it has undecanoic acid in it and B-propolis. And undecanoic acid is more effective than most antifungals because other antifungals come in and they'll kill off the yeast, but these hypha that have, they're like roots and they've dug deep into the epithelial cells, they are still there and basically the yeast just grows back. So what the undecanoic acid does is it stops this hypha production from the yeast, so they can't attach. So then the candida goes through the system. And then
Can you use this product along with like the megaspore?
Yes. But what you might find out is if most people, I'd say 80% of your clients or customers can handle these products with no problem. But there's a percentage that are very hypersensitive, and you're going to have to go even slower than the titration. And it may be that those individuals can't handle the endotoxin die-off at the same time as they're getting an exotoxin die-off. So you might stop the total gut restoration, work with this product till things clear up, and then go back to the total gut restoration. Some practitioners will pulse, as in they'll do this for 2 weeks, then they'll do the other program for 2 weeks. So you have to find out how much your client can tolerate. You know, they, with women, especially if they've had a previous yeast infection, even though the recommendation says 2 gel caps 3 times a day, don't start out with that. I start out with 1 gel cap the first day, 2 the next day, 3 the next day, and if they get any kind of exotoxin symptoms, and with candida, there's a whole list of them. It can range from dandruff to thrush to hives to vaginitis, itchy anus, if it's a man, jock itch, foot fungus, you know, so there's just this whole list of things that can manifest. And with women, though, I've found that it tends to affect them emotionally. So I warn them, sometimes they won't have a physical manifestation, but even if they start feeling really weepy and tearful or agitated and angry, that's still a candida symptom, and as well as sugar cravings. You know, these yeast crave sugar, and so what to do to mitigate the response from this is to slow down. Think about, you know, flushing out these exotoxins by drinking a lot of water, using IgG 2000, which we sell as a separate product because of die-off, and that helps neutralize by binding up the exotoxin, and helps a person, you know, progress through the program, because as they do, they start feeling really good. I mean, this candida affects our energy level, it affects our emotional level, and it's good to be free from all of that. Okay, this MegaGuard is an upper digestive support, and it's got artichoke to help with bile flow, which we have found has now its own detoxification phase. If you've read any of what's her name, Kelly Halterman, Dr. Halterman's work on phase 2.5, this is an important area because bile helps control the dysbiosis in the upper intestinal tract. So if you have poor bile flow, you have more dysbiosis, and that dysbiosis unconjugates the bile that's trying to carry out the toxins from your body, causes a recirculation of those toxins, and with an individual with a damaged gut, causes a lot of irritation and can cause either constipation or diarrhea. And which we have been, I've had some practitioners call that have had some ulcerative colitis patients who have suffered with chronic constipation, I mean, chronic diarrhea for, I think she said this individual had for 6 years, and this cleared it up really quick, which means that it hit the nail on the head, that this was a bile flow issue. It was unconjugating these secondary bile salts and irritating her bowel so much that she just had this constant diarrhea. So that was great news for her. She was able to clear that up with this product. The other cool thing about this product is the type of licorice. It's a potent flavonoid licorice that stops the protein synthesis of H. pylori. So you can get that under control. It also has ginger, which is helping with the gastric emptying. So for your constipation individuals, this is another helpful product because it helps with that gastric emptying, both in the stomach and in the intestine. Wheat Rescue has been an important product because of how much inflammation wheat and gluten causes. Actually, it causes it in everybody, but not everyone realizes it. So of course, individuals that are testing positive for gluten, gliadin, and celiac, they're trying to avoid any of those proteins, but it's really hard to avoid them because even in gluten-free restaurants, we find that there's still about 30% gluten. So these enzymes help break down the protein structure so that they're not immunogenic. And this formula contains some spores so we can keep their gut intact as well.
Is there a study on that one?
This product, if you know Tom, his last name O'Neill, Tom, maybe it's on the label here. He is the world's renowned gluten expert. This is his formula, the most advanced evolution of his formula. He has probably 12 different, as he's learned more about these products. So he has the studies on his website. And when I think of his name, I can tell you his website. I thought oh, here it is, Tom O'Brien. Yeah.
Tom O'Brien.
Yeah, so, and he actually has like a certification program where you study the mechanisms, the physiology of all of this, and then you can get a certificate. So you're a wheat and gluten certified practitioner. So this slide is to show really the importance of our vitamin K2 products. We have two formulas, the megaquinone and the Myomax. What we realize about K2 is that most people are deficient just if they have dysbiosis in their gut, and if they're not getting enough sun exposure, and if they're taking too much D3, because D3 will deplete your vitamin K2, which is also in the fat absorbing vitamin family. But here's how vitamin K2 works in the body. There's about 20 different receptors in the body that are K2 dependent. Its job is to carboxylize, or basically ionize calcium out of soft tissue and get it back into the bone. So what's happened is that now doctors are educated about how important D3 is in mobilizing calcium, but if you don't have K2 on board, the body doesn't know where to put the calcium. So this, the D3 is the bus for the calcium, but K2 is the bus driver. And that's why we're seeing when you implement K2 in the body, that a lot of the high blood pressures that are caused by calcium deposition in the vascular system, they will normalize. The kidney stones, because of calcium depositing in kidneys, will normalize. Gallstones, the atherosclerosis, even Parkinson has been shown to be plaquing of calcium in the brain. So this is a real important product, and because it's a fermented product in the gut, it's an important microbiome product. So this is what we call our high absorption formula, because it contains magnesium and zinc to help the absorption. It also contains a small amount of K1 because your body spares K1. And what that means is if you don't have enough K1, your body will convert K2 to K1 because K1's involved with blood clotting aspects. And this is a hepatic vitamin. K2 is extrahepatic, as in it has nothing to do with blood clotting, and it's outside of the liver. The second formula is Myomax, that doesn't have the K1, doesn't have the magnesium or the zinc, and that way you're not doubling up if you're giving other supplements. And the K2, and we use this formula because we're trying to show it's not anything to do with magnesium, zinc, or K1, but it's the K2 that you'll find a lot of research out there on the internet. We wanted to find an area that had not been well researched. So our clinical trial had to do with the cardiac output and blood volume. And what we showed was high significance increase of cardiac output, which was 13%, and blood volume increase of 25%. So what it says is that if you're an athlete, of course, it will give you an edge. You can basically work out less and have more impact on your cardiac output and your blood flow. But it also means if you would like to exercise more, you can get more results by using a K2 without, being an athlete. Okay, so that was the end of that. And I wanted to show real quick, this is a brand new product. It's not in that slideshow yet, but it has to do with Mega Omega. And everyone carries a fish oil, but as with many of these products, they evolve. And the latest and greatest in fish oil, some of the things you'll see on the label here that you won't see in other fish oils is this DPA, which is very important because DPA will convert to EPA or DHA depending on if the body needs it. The other thing are these high, what we call PRMs, which are pro-resisting modulators, and they're really the key for reducing inflammation. And you'll see that we put an actual quantity on there. So you're going to see all fish oils now starting to evolve to include PRMs and to show the actual quantity of the DPA. We're just the first. So they'll all follow suit now that we've raised the bar. Of course, these are all small fish, so there's no bioaccumulation. They're, through facilities in Norway, Germany, and Miami. The fish are caught off of the, western coast of South America. So this is a very controlled industry, of course, with very high QA/QC requirements. But what we wanted to find was a fish oil that helped the gut specifically, and this is the best one out there on the market. So it's helping with increased diversity, and it's helping decrease the inflammation. Of course, we see a lot of benefits. Most people are educated about fish oils, but it's good to keep up and keep with the latest and greatest. Here we talk about what are the mechanisms that it actually helps with gut by lowering that LPS, which we saw what a problem that is in the gut. We can produce by changing the LPS, you're encouraging certain good gut bacteria to grow. Of course, our keystone strains is what we're focused on. We monitor the alkaline phosphatase, and this is an intestinal, not like what you would see generally on a typical blood test. That's a hepatic type. This is intestinal, and this too is going to help lower the LPS and decrease intestinal permeability and improve microbial diversity. So this truly is a fish oil that's going to help the gut. Of course, there's studies on ulcerative colitis and how it helps improve calprotectin levels, increase the goblet cell differentiation, reduce inflammation, and improve the microbiota composition. We talked a little bit about that DPA, which is an up-and-coming thing, and we have focused on that. We focused on the pre-resolving mediators. So we're really getting down into the weeds on how this fish oil reduces inflammation. And we show some competitors in there and how we stack up. But I just wanted to show you, we've got a lot of good features on this oil. And it gets, if you're interested in all those mechanisms, I can share that with you too. But just to know it's different and very powerful. And then the last product we launched is the Phytospore, which is for dogs. And we will soon have a study that'll be published that shows dogs also have metabolic endotoxemia, and that these spores reduce their endotoxemia by 45%, which is highly significant. So unfortunately, our furry friends are suffering with the same gut issues as their peeps, but it's good to know that the spores can help. So with all of that, what questions do you have?
How do you just like navigate all of these different products? Like, how do you know like what to incorporate, what not to incorporate, and yeah.
Great question. Great question. What we're finding is that if you start with Megaspore, it is going to really give you the best indication of how much gut damage and how much diversity you've got, because a lot of our docs will call Megaspore the poor man's stool test, because just watching how the body pushes back. So 80% of your individuals are going to be fine. They're going to be able to titrate up. But what you're looking for are those 20% that are going to struggle, because those folks are the ones that are going to take up 80% of your time. So you titrate out, you find out your 80%, and they can just go off, take your protocol, go through the total gut restoration, and in 3 months, they're going to refer their friends and their family, because they love you, and it's helped them so much. The 20%, you've got to customize some protocols, and more than likely you'll have to open up the capsule, have them go much slower. There are going to be probably half of that 20% that they can't handle Megaspore at all. Even a pinch of the powder. They'll say, when you're looking for gastrointestinal responses, it can be gas, bloating, the constipation, diarrhea, foggy thinking, anything can really manifest. So you just have to kind of give them an expectation up front to let you know what they're experiencing. So you take those individuals that are having a hard time with Megaspore, and you just tell them, look, you can't handle Megaspore right now. We're going to put that to the side, and we're going to start with a 1 or 2 spore probiotic, and then graduate you to Megaspore. So it's a matter of retraining their immune system, because the 5 spore, they have such a damaged immune system, they just can't handle all 5. So when you start with the HU58 and you're dealing with 1, then you have to break everything down to its most simple components. It could be that the HU58 and the IgG2000 is all they can handle. And you're using that IgG2000, again, to neutralize or to bind up that lipopolysaccharide. So it's a matter of knowing what are the strengths of your tools and how to mix and match them for each individual. So you kind of watch, have good communication, and have them report to you their experience. And you've got the tools available pretty much for anything that can come up. Plus, let me be your coach and your guide. A lot of times practitioners, I will kind of walk through the first few clients they have with real difficult gut issues, so that they don't feel, that they're experimenting on someone, but they've got some guidance. So know that that's available to you.
Mm-hmm. I do have a patient coming up who has celiac. Mm-hmm. And aside from the basic don't eat gluten, what would you say? Would you use the wheat? What it's called, the wheat one?
Yeah, the wheat rescue. Wheat rescue. Yes, because they're faced with trying to reduce inflammation, of course, from the wheat, but the whole diet, because they've got gut damage now too. That inflammation has, we're probably looking at that first slide that leaky gut is, what they're experiencing.
Mm-hmm.
Oh, I did forget to go over the stool kit here, but yeah, so for the celiacs, you're having to rebuild their whole gut, just like, with other metabolic endotoxemia. So working with the wheat rescue is part of it, but introducing the megaspore and then sealing their gut, all of that's going to come into play. Now, do you do stool testing?
No.
Okay. There's a lot of practitioners out there that that's part of their practice. The whole functional medicine education is pre and post testing. Um, and we really tried to stay out of the stool testing arena because as we got into it and researched it, the stool tests out there had such old technology, they were really wasting people's money. But because so many were insisting, for Kieran to try to, they'd send us all these different reports and wanted Kieran to interpret them, he realized they weren't going to go away. And he pledged, okay, if we're going to get into this stool testing business, who has the top of the line stool test on the planet? It turned out that it was these folks here, Cosmos ID. They are the ones that did the Human Gut Project, the Human Microbiome Project, and the American Gut Project. They're the only ones that have received an award from the FDA for accuracy. So they have the top notch and the latest technology. So that's why we went with them. But still, if you're really into the science and need to get down into what species and what's going on, that's the test to use. But I can tell you that a lot of your patients, some of them are really into this, but a lot of them aren't. They just want you to help them. And
Mm-hmm.
once you start understanding every person's going to respond differently, and start feeling comfortable with, okay, you're now, I recognize you're in the 20%, you're struggling with megaspore, so you've got a lot of gut damage. Let's down step this to a simpler protocol and then work you up. If some candida pops up, you've got a tool for that. If they've got an upper digestive, GERD and reflux going on, you've got a tool for that. The IgG 2000, you can use at any time to calm down the immune system. But it's really the communication that they are telling you what's going on that's going to help you respond with what they need.
Okay. Is this safe for pregnant women?
The one thing with pregnant women you don't want to do is have a bunch of die-off happen. So you say yes, but at really, really low amounts so that you can control that die-off. Because if die-off gets so severe it starts causing cramping, then you're endangering the fetus, and you don't want to do that.
Okay.
So I would start with the HU58 at the very simplest formula, some IgG 2000, and just work up from there. The best time to help a woman with her microbiome is before she gets pregnant. That's not always possible.
Mm-hmm.
But emphasizing to them that it's their microbiome, that the health of their microbiome is going to determine the health of their fetus's microbiome. And of course, if at all possible to have a vaginal birth, if at all possible to breastfeed, there's nothing really that can beat those inoculations for their infant.
Mm-hmm.
But that's not always possible. But know that that infant, if they have had a C-section or have been bottle fed real early or had antibiotics, they're going to need intervention right away.
So with kind of going back to my very first question about my friends' kids, about how much would you titrate for them?
Now, how old are her kids?
One is, I think, less than 1, and then, the other is probably around 3 or 4, I
Okay.
would say.
Um, for the one that's less than 1, a fourth to a half of a capsule,
Okay.
and they can do that every other day, and then just keep working up, to a half a capsule every day. So if they take a week and see how um, the baby handles a fourth, and then, work it up. It's not, you can't overdose on these spores. What you're looking for is how much damage is in the gut. And so you want to start slow so that you're not going to get a lot of that die off. Because especially it happens in adults, but especially with kids, first time you give them a tummy ache, they're not going to cooperate with you.
Mhm.
They're really going to resist. So if you got to start slow enough so that they don't feel anything, and they don't care if you put it in their applesauce, or and
Mhm.
start telling them this is their super sauce, or you can help kids get involved with their health. I
Mhm.
convinced my grandson that um, I think it was an Odwalla green machine is going to help him grow muscles. And he was like one of those kids that would never eat anything green,
Mhm.
unfortunately. Um, and he got to where he would start asking me for it. Grandma, I need more muscles. Where's my drink? So you start kids young, they won't resist good health. But um,
Mhm.
the other the other child, anything again over 2.5 years old, they have a mature microbiome. So it's not yes, we're basically dosing by weight, but we're starting slow just to make sure they have a good experience, find out how much tolerance they have based on how much gut damage they have. Um, but anybody over 2.5 can easily handle a capsule, every day. Just work up to that.
Okay. And then if you're like opening a capsule using half of it, what can you do with the other half, or are you wasting half of the capsule?
No, you don't want to waste it. What I say, I'll take 2 glasses, put half in one and half in the other. Leave one dry because you don't want to pre-mix it in liquid because it'll ferment. Unless you
Okay.
want to make kombucha or sauerkraut, you can do that. But just
Mhm.
know that it'll be bubbly, and kids won't like that. So,
Yeah.
so put the other one aside till the next day, and then put water or juice, in the one that you're going to take that day, and then just keep that going. Start out every other day for a while, and um, yeah, they should. If they complain of anything, then just go slower. Cut the dose. Whatever you're doing, cut the dose in half.
Mhm. Okay. I'm trying to think of any other questions I might have.
Well, just if you think of something after we finished, open door policy, text it to me, email it to me. I try to, you know, get it to me while you're thinking about it, and I'll try to get to it because the sooner the better. You probably,
Hmm.
some folks have texted me when they have a client in front of them. So if I can get to you that fast, I will try.
Okay. Well, that's all the questions I have for now, but I will let you know if I have any more.
Perfect. Well, great. It was great to meet you,
It was nice to
and,
meet you too.
and I hope this is helpful.
Yeah, it was. It was great. Thank you so much.
You're
Thanks for taking
welcome.
the time.
Take care.
All right. Bye.
Bye-bye.